Welcome to Medicine Made General, a podcast for patients brought to you by the Johns Hopkins Division of General Internal Medicine. I'm Katie Cavanis Crowley, and I'm here with my co-host, Dr. Bimal Asher.
Hello, everyone. Welcome to Medicine Made General month of November, which, as some of you may know, is Diabetes Awareness Month. So we took this opportunity to talk about one of the most common health conditions we see in primary care, and that's type 2 diabetes. And we're fortunate today because we have one of our esteemed faculty, Dr. Nisa Maruther, who is a clinician and researcher at Hopkins who studies type 2 diabetes prevention and treatment. Nisa also leads the Brancati Center for Advancement of Community Care, which is celebrating its 10-year anniversary this year. Nisa, welcome to Medicine Made General.
Thank you. So happy to be on today.
Yeah, thanks for joining us. And I mean, in addition to Brancati Center, Nisa, I was looking at all of the titles that you hold: Medical Director of Green Spring Station here at Hopkins, Director of GIM Medicine Fellowship, Co-Medical Director, the Diabetes Prevention Education Program. The list goes on. So I just wanted to note those because I think it's important for our listeners to understand that I think we have the best of the best on today to talk about this stuff. So let's start with the basics, though. When patients hear type 2 diabetes, it can sound kind of scary. How do you explain what it actually means and what symptoms people should look out for?
Okay, yeah. So diabetes mellitus is generally a condition of high blood sugar or glucose. The glucose is elevated in your blood, and it affects every organ in your body pretty much, having high sugar. It's type 2 diabetes is the most common type. About 95% of cases are type 2 diabetes. And so that's really what we're mostly talking about when we talk about diabetes. And it's in particular thought to be caused by two things. One, the inability of the hormone insulin to get glucose or sugar into your cells. And this is important because every cell in your body needs sugar. And then the other thing that can happen with type 2 diabetes is the reduced ability of your body, your pancreas, to make insulin. Oftentimes with diabetes, there are no symptoms at all. So a lot of people are unaware they have it when they get diagnosed. And if your glucoses or sugars are really high, you can have symptoms. You can have frequent urination, blurry vision, fatigue, weight loss. Those are some of the most common things that we'll see. And your blood glucose have to be pretty high. So just because you feel fine doesn't mean you don't have diabetes.
Mm.
Yeah, and so, Nisa, along those lines, we in medicine, we like to put pre in front of a lot of things. And so people get talk about, having a precancerous condition or having pre-hypertension, and pre-diabetes is something that is getting a lot of press. And I wonder, how is that different? And, as a patient, should I really be concerned that this is serious?
Yeah, so prediabetes is a condition that precedes type 2 diabetes. And basically your blood sugar, blood glucose is high, but it's not normal, but it's not yet in the diabetes range. It's serious and important to know about for a few reasons. One, in itself, it raises the risk of nerve damage, kidney disease, and cardiovascular disease that we oftentimes see with diabetes. A lot of times people don't know that. Two, between 5 and 20% of diabetes right now will have diabetes next year. And so there's a high risk for you to develop diabetes if you are in the pre-stage. The other thing is being in this stage is good to identify because you can prevent type 2 diabetes, which I think we'll talk about. So knowing that you're at risk with prediabetes means that you can also do something about it.
That's helpful. Thank you for making that distinction. Back to preventing it. I think many people are surprised to learn that type 2 diabetes can often be prevented, delayed, or even cured. Is that really true? Can you tell me more about that?
Yes. Yeah, the answer is yes to all three. For preventing diabetes or delaying it, it's really about weight loss, if you have weight to lose, and then improving your nutrition, eating healthier, and increasing physical activity. The diabetes prevention program, we have one that we do through the Brancati Center, is a year-long program that's focused on diabetes prevention to help people meet those types of goals. And it really has the best evidence behind it to prevent or delay type 2 diabetes. Metformin also is a medication that we oftentimes use to treat diabetes that can be used to prevent diabetes when you have prediabetes as well. And then the cured part is a little tough. It is true. The definition of cure of diabetes is it's actually pretty easy to meet that criterion, and that is to have, say your blood sugar is high in the diabetes range. If you have a normal measure of your glucose or hemoglobin A1C for 3 months and you're not on any medications for diabetes, that's considered remission of diabetes. I personally think that 3 months is a little bit short. It used to be a year, but the idea is that your blood sugar or blood glucose are controlled or not in the diabetes range, and you're not on medication. The best way to get to that point, so if you get diagnosed with diabetes and are interested in this cure or remission and really want to get to that point, losing 10% or more of your body weight is really that's where the best evidence is to get to that. But it is very difficult. We'll talk more about behavior change and how difficult it is. So I would say the majority of my patients don't end up in that cured or remission situation, but they can have really good control.
Yeah, along the lines with what you just mentioned, right? You've done a lot of work, a lot of research on how to best prevent or manage type 2 diabetes. What are some of the steps that you recommend for your patients and others to control, prevent, or manage diabetes or prediabetes?
Yeah. So first, well, I'll start with prevention and then go to management because they're two different things, as many of you will know. So prevention of type 2 diabetes, it's all about lifestyle or health behavior change. I mean, that's what you can modify. We think type 2 diabetes is probably 50% genetics and 50% your environment and health behavior. So some people are going to have type 2 diabetes because their genetic risk is high, but the part you can control is about your health behaviors. So maintaining weight loss if that's needed, healthier nutrition, increasing physical activity. And I've already said these things. And most people know that that's what they need to do, but it's really hard to do it. And the diabetes prevention program, which I mentioned, is an excellent evidence-based program for this. But something that we've learned over the last several years, even though we have that program available, is most people don't do it, and it's not available to everyone. The other thing that I think is really relevant to diabetes prevention, which is not something that oftentimes patients or people can control, is that insurance coverage, while it exists for the DPP, the Diabetes Prevention Program, for Medicare and Medicaid in many states, the coverage isn't enough to have enough programs for everyone who needs them. The other thing that we kind of know about diabetes prevention is, and I mentioned metformin as an option, is that online versions of the diabetes prevention program can be effective too, so can reach more people. But again, the coverage of those programs is probably not sufficient to get them to everyone that needs them. For managing diabetes once you have it, the story has really been about the medications that are relatively new. They're not so new anymore. A lot of them have been around for 10 years or more that reduce the risk of cardiovascular disease, kidney disease, heart failure. So those are the GLP-1 receptor agonists and the SGLT2 inhibitors. And then, of course, everyone knows about the GLP-1 receptor agonists and their effects on weight. So those are the Ozempic, Mounjaro, et cetera. Those are game-changing medications, but not everyone has access to them. And we know that many people who meet criteria, when we look at our own data, if they meet criteria to be on them, they're oftentimes not. But those are some of the kind of the biggest things that I'm thinking about these days for preventing and managing diabetes.
So, I mean, just in discussing the biggest barriers that people face, specifically when trying to reverse and prevent diabetes, can we just think about this a little bit more and maybe like a quick list of, what do you think gets in the way of most people preventing or reversing? I started to touch on it a little bit there in your previous answer.
Yeah. And I want to acknowledge again that changing your health behaviors is really, 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 really hard. I think anyone who tries to make changes, and again, it's about, when I'm talking about health behaviors here, I'm talking about healthier nutrition and increasing physical activity, and then weight loss that can come with that. But it's the thing about about that, and it's not simple, is that it's really about figuring out how to incorporate those things into your day-to-day life when there's so much stress in everyone's lives, and our environment does not support that. We live in an environment where being sedentary is a very easy way to be, where access to unhealthy food is everywhere, and access to healthy food may be very limited in a lot of places. So I'd say, to sum up, it's really time and then resources that are major barriers. Programs like the diabetes prevention program can be helpful. The reason it's a year long is because no one really figures out how to do this in 2 months or 1 month. And it's really important the program really focuses on helping people make those changes in the context of their own lives. There's not like a one-size-fits-all approach. Those are some of the biggest barriers and how I think about addressing them.
Lisa, I want to shift gears a little bit, but not completely. And you've spent a lot of time thinking about how to get care to the community and meeting people where they are. And as director of the Brancati Center, I wonder if you could tell us about some of the work that you do with the Brancati Center and how that tries to address some of the things that you just mentioned.
Yeah, thanks for asking about that. I love talking about the Brancati Center. So back in 2015, when we founded the Johns Hopkins Brancati Center for the Advancement of Community Care, the idea was really to develop and implement new models of care that are outside the walls of the hospital, knowing that most people spend most of their time, thankfully, outside of the hospital and outside of the clinic. And so one of our sole goals has really been to bring evidence-based interventions to our community. So for example, when we started our diabetes prevention program, before the pandemic, we conducted all of our classes at community sites, mainly churches in East Baltimore, because this is the community we serve is like East Baltimore. We've expanded a lot. But doing that, being where people really are, instead of making people come to our clinic or come to the clinical setting, really helped us get the kind of engagement that you just don't see nationally. That's why I think our program is one of the best. And it really helps our participants meet their goals as they support each other in their own community. And so that's really the goal of the Brancati Center. The DPP is one thing that we've done, the diabetes prevention program.
So looking back at the past decade, I would just love to know, what are you most proud of from the center's first 10 years?
Hands down, I'm most proud of the connections that we've made with our community partners, engaging or earning trust and implementing programs that actually change health outcomes. Those things have been the highlight of my career. And it was really the goal that we set out. That was the whole point of the Brancati Center. So it's really been about the people.
Yeah.
Thanks.
So as you look ahead, next 10 years and beyond, what's next for the Brancati Center?
Well, we're in uncertain times.
Okay.
We're in a totally different time from when we, back in 2015. One of the things, the Brancati Center, we've done a lot of work with diabetes and diabetes prevention, but that's not been our sole goal. It just happens that we've had a lot of expertise around that, and our community is very interested in diabetes and preventing diabetes. But right now we're in a situation where the infrastructure that supports basic preventive care is under attack, whether it's insurance coverage or loss of other social benefits. And one of the things that we've learned through doing the diabetes prevention program is how to help our community navigate the existing resources, mainly through the work of our excellent community health workers. And to this point, like I said, we've been focused on diabetes, done some work with high blood pressure. But I think what's really next for us is how we're going to help our community navigate the health system in this new and uncertain era, in which resources are just vanishing. And I think that's where we have to be. It's like, what is it that our community needs now?
Mm-hmm.
As we kind of look to wrap up, Nisa, I wonder whether there's one or two kind of tidbits or messages you'd like to give to our listeners about diabetes awareness, this being Diabetes Awareness Month, anything that you think that they should just focus on.
Yeah, so I'm a general internist, as you know, and we care about prevention. So I'm a prevention person. So I think the first message would be, make sure you've been screened to see if you have prediabetes or diabetes. for the reasons that we've already discussed. If you have prediabetes, think about joining a diabetes prevention program. If you have diabetes, making sure that you get all of the preventive care and tests, because we can prevent some of the complications. Diabetes is the leading cause of blindness, kidney failure, and limb amputation, and doing the preventive testing is really important to avoid those things.
That's great advice, Nisa. Thank you. And as we wrap up, I just want to say thank you so much for joining us. Congratulations to the Brancati Center. 10 years is no small milestone, so that is fantastic. I just really appreciate you taking the time to speak with us today.
Thank you. I appreciate you guys asking me.
Yeah.
And thank everyone for listening to this podcast. To learn more about diabetes prevention and the Brancati Center, please check out the links in our show notes.
This has been Medicine Made General from GIM at Johns Hopkins. Thank you for tuning in. We hope you found this conversation helpful. Until next time, stay informed, stay healthy.